Hello, this is Dr. Gay from First Look MRI, and this is a 53-year-old male who complained of numbness and tingling from his pelvis all the way down through his legs to his feet, and he had had falls because of the symptoms. He went to his doctor, and they were worried that he may have a disc herniation of the lumbar spine or something causing his bilateral lower extremity symptoms and weakness in the legs. So they did an MRI scan here just to make sure he did not have a disc herniation, but his spine looked really good. Here's L1, 2, 3, 4, 5. All the vertebral bodies are straight. The discs look nice and normal. There was no disc herniation, but he did have another finding, which is related to this structure. This is his abdominal aorta. Normally we look at this in every patient to make sure there's no aneurysm or leak. It can be a rare cause of back pain, but he did not have an aneurysm. But if we look on another view where fluid is bright, we see that the fluid in the spinal canal is bright, but also the blood in the abdominal aorta is bright. This is abnormal. Normally flowing blood will be dark. Anything moving will be dark. So we have a blood vessel here that's dark. The upper aorta is dark. And right here on down is thrombus. So lack of the normal flow void. So he has a big cast-like thrombus filling the abdominal aorta, going down into the iliac arteries. We can see the same thing here. There should be dark. This is the inferior vena cava that has flowing blood is black, and this should be the same darkness, but instead you can see wall thickening, some atherosclerotic disease. Above the thrombus we see the normal flow void, which is dark. You can see the renal arteries flowing blood dark. So this is an infrarenal thrombus. Cast-like thrombus fills the aorta and goes down into the iliac arteries. So we told the patient to go right to the emergency room, and hopefully in the emergency room they can get him in to see a vascular surgeon and hopefully dissolve this clot away. And an unusual, very rare case, I don't think I've ever seen one before, where the clot had caused the bilateral lower extremity symptoms and weakness in the legs, masquerading as a disc abnormality. And that's it. Thank you very much.